On your left.
All right, folks. I haven't done one of these in a while. I kind of, I'm already shadow banned, man. And basically doing these things are not particularly good for my channel. But this is one that the doc put up, and I'm going to put a link not only to the article, but I will also share the doc's post. So, if you really want to do it, Dr. Dunbar, if you really want to do it, you don't want to do it on your channel, you can always do it on mine. I will gladly take the hit for my PhD. So it is up to you. If you want to do it on your channel, that's fine. If not, I will take the hit for you. Anyhow, this is from The Guardian of London. The economy cannot stay open. Omicron's effects ricochet across U.S. And stay tuned for my analysis at the end of the article. So if you're listening to me now, skip forward when I actually do my interpretation of it, okay? Just saying it now because it's going to be slightly different from this article, I can already tell you. Schools going virtual, airlines canceling flights, pharmacies and testing centers closing temporarily, shelves emptying in grocery stores because of the transportation delays. Blood donations dropping to the crisis levels for the first time ever, and the country's hospitals are becoming stretched. This is the U.S. in the grip of the Omicron variant. Omicron may cause milder symptoms in some people, but its effects are ricocheting throughout America, creating some of the greatest challenges of the COVID-19 pandemic. We have supply shortages. We have transportation shortages. There are a result of people being out because of COVID, and especially Omicron being so infectious. And that is obviously limiting the workforce. And limiting the workforce is creating some of the havoc that we're all experiencing, said Ezekiel Emanuel, Vice Provost of the University of Pennsylvania. Now, Pennsylvania is getting hit particularly hard, so shout out to them. Joe Biden has vowed to keep businesses and schools open, but some experts wonder if that's possible given the nature of Omicron and the lack of adequate measures to combat it. See what I told you about Biden? I didn't think he would. I didn't think Biden had any interest or any other, I wouldn't say guts, but any other fortitude to actually close down the economy again. Biden's not going to take that one, okay? And the economy probably couldn't stand it anyway. The economy cannot stay open and schools cannot stay open when so many people are getting sick, said Margaret Thornton, an educational researcher at Princeton School of Public and International Affairs. We must take action to slow the spread in order to keep schools running, to keep businesses running, she said, but so much of that action has been slow to happen. In order to control Omicron and future surges, officials need to rely on tried and true tactics, from testing to high-quality masks and better ventilation, say some health experts. We now have tools such as N95 masks, vaccines, treatments, and rapid diagnostics to help prevent infection and reduce the severity of illness, said Rick Bright, CEO of the Pandemic Prevention Institute at the Rockefeller Foundation and former official for the U.S. Department of Health. Nice cushy spot. However, we need to do more to make them affordable and available to everyone with clear guidance on when and how to use them most effectively. Facing astronomical rise in cases in hospitals, health systems have been slammed. Omicron comes on the heels of a devastating Delta wave in the fall and existing staff and supply shortages, with little opportunity to recover. The 7-day average of infections in the U.S. is now running at more than 750,000 cases, far higher than during Delta's peak. Yeah, but fewer people are actually getting severely sick. It was back-to-back, said Jorge Moreno, assistant professor of medicine at the Yale School of Medicine. It's affected every section of healthcare. Health workers have spoken out on social media about being asked to volunteer to restock supplies and answer phones. or to volunteer in housekeeping, food service, and transportation. One resident physician was reportedly asked to work as a scrub tech, a job they never trained for and weren't paid for. Meanwhile, nurses in New York are stretched so thin there are parts of facilities where no one is scheduled to monitor patients. Hospitals in some parts of the country are allowing staff to continue working with positive cases without isolating at all. In Rhode Island, that policy led to an outbreak among patients. Do tell. We can have an empty bed, but if there's not a nurse to manage it or even a doctor to manage it, there's no way to manage the patient. So we're really in a crunch. We're bursting right now at the seams. And since hospitalizations lag by a week or two behind cases, the worst is still to come, he said. Hospitals across the nation may already be more full than official numbers suggest. Maryland hospitals are 87% full according to official reports, but in reality they are closer or exceeding 100% capacity according to analysis. There are also fewer hospitals now than when the pandemic began, particularly in rural areas. In 2020, 19 rural hospitals closed, the most in 1 year since 2005, when data first began being collected. Omicron is also responsible for staff shortages in nursing homes. That leads to facilities limiting the number of new patient admissions and a backup in hospitals among patients who could transition to a lower level of care. Child care facilities are also facing rising cases and staff shortages. Daycares were already strained, with some centers losing up to 90% of workers as of December. According to Cindy Linhoff, director of the National Child Care Association, catastrophic shortages have hit about 80% of centers across the country, leading to closures and long wait lists. Schools have also struggled to remain in person. It's chaos. It's complete chaos, Thornton said. In Philadelphia, for example, there are now 98 schools that have gone virtual, she said. There truly are just not enough grown-ups who are well enough to be in the building. Leaders have gotten the reasoning backwards on keeping schools open, she said. This administration has said they prioritize schools because of the economy. In order to get parents back to work, and I've said this, remember when I said this a long time ago? In order to get parents back to work, and I think that's just really a backward approach. We need to prioritize schools because they're important to kids. Know your child care product. You're part of the child care system. In schools, there are proven ways to reduce the spread of any variant. The measures just need to be taken, Thornton said. These measures include well-run remote options for those who want them in order to reduce classroom sizes and reduce exposure risk. Regular testing where families opt in instead of opting out would make a huge difference, as well as providing guidance on what to do if you test positive. Making sure that all students have high-quality masks is also essential, Thornton said. Just a little bit more. Keeping schools open and the economy running is very important, and the real challenge with so much of the society getting sick over the next few weeks, Bright said. I believe that we can do so safely. However, we need to follow the science, use the tools at our disposal, and use the tools we have appropriately. The reality is that COVID-19 is not going away anytime soon. We need to move from crisis to control, he said. Bright and Emanuel both outlined steps the administration could take to reach its goal, including measures such as expanding testing, vaccines, medications, and rebuilding trust in public health. We are going to have a rocky next 2 or 3 weeks, Emanuel said, but if measures can be put in place, it would have an enormous effect. And whatever measures are put in place now will help address future surges, Bright said. I believe the next variant is already lurking among us now, which makes it all the more critical that we get ahead and stop it before it has a chance to spread like Omicron did. All right. That was a long article, and I'm glad you guys sat through it. And this is my distillation. I see what they're saying, and this is something that some administration officials in the Trump administration actually wanted. They wanted it to spread to get herd immunity. And the reason they didn't is because, 1, we didn't know how to treat it. 2, we really didn't know what it was. And 3, The original one was a lot more deadly than the Omicron. So if you don't take vaccines or you don't take the booster, I'm not going to speak for the Biden administration, so old man, don't get mad. Okay, my opinion is a lot of countries, a lot of governments are seeing this as the fourth way out. You can't get people to continually take the boosters or continually take the vaccines. But what you can do is let a less potent variant actually spread and hopefully do the work for you. Are you going to lose a few people? Well, you're going to lose a few people anyway. And maybe, just perhaps maybe, you'll lose less people with this than you would even with the vaccine. So they're willing to roll the dice with the Omicron. Hopefully the Omicron will spread far enough, fast enough, and give people a mild enough shock. Because basically, if Omicron spreads and get people mild symptoms, okay, it's doing the same thing that the vaccine would have done anyway. What is the vaccine going to do? It's going to give you mild system to do what? Alert your immune system. And hopefully the Omicron variant could be for them the best sort of vaccine that they could possibly come up with. So maybe nature has given them the answer. But in any case, about them closing down an economy, locking down a government, Germany tried it. Even Germany. Now, Germany is a very authoritarian country. Okay, regardless of what you think about it. And those people are used to being under an authoritarian government that tells them what to do. They push back because they're tired of it. And I'm saying that the United States, which is far more liberal than Germany is, okay, Biden is not going to, number one, spend the money. And number two, he is not going to take on the anger of the American people for trying to do what Trump and Fauci did back in 2020. He ain't going to do it. Especially during a midterm election year, not going to happen. It's going to be a case by case, state by state, I think even school district by school district policy. The LA City School District, which has been extremely vigilant and extremely really sincere about locking down their students, right? They didn't do it this time. It's still open. Okay, do you have to distance? Do you have to wear masks? Yeah, you got to do all that. But thing is, they're not doing the same thing that they did in 2020. They're not doing it, okay? Kids are going to go to school. People are going to go to work. When you go out in public into a crowded area or a store or something like that, well, you got to wear a mask, okay? But other than that, they're not doing the same thing. In last winter, California got hit hard. I mean, really hard with deaths, and Delta did a number. Was it Delta? I think it was Delta. It did a number on California, man. Did a number on California. It did a number, especially in LA County, man. 350 people a day were dying in Los Angeles, man, during their peak. So a mild variant, man, they are not going back to locking down the city or the state. They're not even talking about it. Nobody wants that smoke, and nobody wants to spend that money, including Joe Biden and the Biden administration. They don't want that smoke, and they don't want to spend that money. Biden said so. So unless you're like a smaller country like New Zealand or Australia or even Japan, even China's not locking down. They don't want to spend that money, and they don't want that smoke. So even though I agree with the doctor that you should take precautions, I don't think Doc is really, we have to wait for his analysis. But, he doesn't really want to do it on his channel because they get real antsy about him doing anything about COVID. Probably because he's been right. Him and Nicole, they've been right about this particular bug. They've been 100% right, which is probably why they don't want him talking. But like I said, Doc, if you don't want to do it on your channel and you need a place to do it, I know I'll raise my hand. I'll do it with you. I'll do it on mine, one of mine. But other than that, is it a nothing burger? No, I think the Guardian is probably right. Okay, if you want to be cautious, but the thing is, they can't turn a super tanker like the United States around in mid-ocean. No, it takes hours to turn a super tanker around. I do mean hours. And a big boat like this one is not going to turn around on a dime. Even the last time we tried it, man, it took a month to actually put the U.S. into lockdown. It took a month and it didn't go well. So I don't see it. I don't see it in the future. So anywho, I thought I would go ahead and read this into the record for the doc because he was kind of leery about doing it. So I'm going to read it. I'm going to put the link to the original article in the description. And I'm also going to put a link to the doc's channel. And I'm also going to share, if you hit the community tab, I've shared his community post of said article. But with that, I'm going to jump off here. This is BGS out, and I'll see you guys on the next one.